the Bald Oncologist Podcast Series, featuring Dr. Malwender.
Hi everyone, I'm Dr. Marfu'ah. Welcome to the Bald Oncologist Takeover by me.
Wait, that's my line.
I kind of like it here.
Then I shall invite you more for the show next time. So hi everyone, welcome to the Bald Oncologist Podcast Series. So we have Dr. Marfu'ah back again to talk about lung cancer today. So Dr. Marfu'ah, let's share a patient story which has really impacted you.
Okay, so I think you were mentioning about stage 4 lung cancer because I
Yes.
think that's the common group that we see.
Correct, it's very sad, right? In our country, we detect all quite late.
Right, it's about I think 80% will present at a very
Yeah.
advanced stage, and this is the point where it's no longer curative. So I think looking back, I would say it's my 24-year-old patient.
Oh, so young. Wow.
We think that you're 34, you're on your high-driven career, you just got married, just got your first baby, and then lung cancer. So she's 34. She's also a doctor,
Oh,
and she was about like us, wanting to start postgraduate studies. And when she knew that she had lung cancer stage 4, but that was 5 years ago.
is she still alive?
She's alive, and her daughter has just started standard 1.
Wow, okay.
And she's walking around us just like any normal person.
So what treatment she had?
So she was an ALK positive lung cancer. So ALK is a driver mutation. So nowadays we have moved away from having lung cancer as a one entity
Correct.
disease. So now we look at lung cancer in terms of its behavior, and the behavior is driven by the mutations that the patient have.
So we're not talking about chemo anymore, right?
No. Actually, you need to know that there are options other than chemo, and there's more options. As the year passes, you get more options of treatment. So she has ALK. You have the other mutations. I think more commonly in our setting is the EGFR mutation.
Yep.
That's also treated by oral therapy. You have the ROS1, and then there are other mutations that we can also check, which is we can also use targeted therapy, or you can also use immunotherapy if your cancer is proven to be more immunogenic.
So all of this, how do you find out? Is it a blood test or a biopsy?
So most importantly, patients need to know that all of these tests is feasible by a tissue biopsy.
Okay.
Because I think in most of our settings, sometimes patients hear that, they need to go through, they need to have a needle, they need to have a scope to get a tissue biopsy. But without that, we are pretty stuck. So if you want your treatment options, you need to be able to go through for this, and where they take your tissue and they look at the behavior of the tissue first, looking at which type of lung cancer do you have.
So everybody will be different, right?
Correct.
So you can have 10 lung cancer patients, but your biopsy will show different mutation, and your treatment will be all different.
True.
Okay.
So, yeah.
So for certain mutation, for example, EGFR, is that like only one drug, or like there's a lot of drugs available?
No, I think when we started like way back, when we were studying, there was only like one EGFR medication.
Yep.
But throughout the last decade, we have seen a lot more. We have seen even more potent EGFR TKI. So then it works better. It also works longer. It also reduces the chances or the toxicity compared to the earlier one. So we do get better from time to time. We have better development of drugs as well.
So how do someone actually have this EGFR mutation? Is it a common mutation, or it's like everybody who you check will have this kind of mutation?
Well, interestingly, is a disease of our area, basically all the Asian patients, because when they look at all these mutations worldwide, they see this particular mutation higher in our setting.
Our Asian setting. Okay.
Asian setting. And it's more common in the never smokers, people who never smoke. So you need to know that without smoking, you can also get lung cancer, and it's more common in women. And this is more apparent in our setting compared to the Westerners. I think Westerners only about 20% of them are EGFR positive.
this kind of treatment, like this targeted therapy, which targets EGFR, ERK, ROS1 and all, is it like chemo by cycles or is like continuous? How long do you take
No,
it?
so when you have stage 4 lung cancer, you have to understand that treatment is mainly for control of the disease. So as long as it works, you should be on it. So for targeted therapy, it depends. So some of them can be controlled by the targeted therapy for about maybe 1 year or 2 years. Okay, I think some ALK therapies can go even longer. Like my patient, she's on it for 5 years.
Wow, the same drug.
The same drug.
Oh, that's fantastic.
Yeah, but by chemo, it's different. So chemo is bicycle because normally we stop because of the toxicity.
Yeah.
So all the targeted therapies are generally more tolerable. Their toxicities are not as serious as we have in chemotherapy.
So why do some patients need to take this treatment lifelong?
Yeah.
I've seen some patients like keep on changing drugs on and off. Sometimes use this drug, sometimes use that drug.
I think we need to know that cancers are actually very intelligent. So one drug that might work in the beginning, after a while will stop working. It's because they find a new way how to evade this process. How can they actually find a new pathway to grow? So that's where treatment starts to become resistant. So when treatment becomes resistant, we need to move on to another therapy. And what therapy you need to go for? Sometimes we do another biopsy to see which mutation is available, see whether there's any medication that we can target.
So something like antibiotic resistance, you have to keep on changing antibiotic, keep on taking
Yeah.
cultures and all.
Yeah, but when antibiotics, you don't take it for a long.
Yeah, correct. Just take a few days. Yeah. So targeted therapy, like your patient took it for 5 years. Was there like a lot of toxicity or it was quite barely minimal?
I think that's also a basically individual variation to it. You can give the same medication to 2 different patients, same gender, same age, but they will have different toxicity.
Yes.
I think for her, she had it like very smooth sailing. I had another one who had toxicity with the same medication, but it's more on the liver enzyme. It was quite bad that we had to actually stop and change him to another medication.
Okay. What about immunotherapy? Is it the same pathway, the same way it works?
Right. So immunotherapy, interestingly, we are in the era of immunotherapy nowadays. So it works differently in a way that it stimulates your own body response to fight the cancers, to kill the cancer cells. And even though it might start a bit later, the response compared to chemo and targeted therapy, but we often see durable response, longer response, because you're already stimulating and actually conditioning your body to basically kill the cancer cells with your own immune system.
So that means when you start immunotherapy, you have like a long-lasting effect even when you stop your immunotherapy.
Yeah, we have seen that.
Okay. So all these treatments actually prolong patients' life. They give them a very good quality of life with very minimal toxicity. But it also comes with a cost, right?
Correct. And I think that one we can't deny because the more advanced treatment you have, the newer agents you have, then it costs you a lot more. For example, when we were talking about the EGFR medication that we have, of course, the older ones are cheapest and the new ones are very expensive.
Yeah, that's a sad part. Cancer treatment is always costing more and more.
And you have to have it for lifelong. So we do have patients who are on treatment, but unfortunately have to stop because
The cost.
Yeah.
So always we advocate for early detection for the patients, right?
Correct.
Okay. So Dr. Marfu'ah, is there anything you would like to tell to our participants today?
I think for lung cancer, because we tend to see them very late. Again, you need to know your risk. Even though, as I said, even if you're not a smoker, you might get lung cancer. So if there's something that's not right, for example, you're having cough more than 2 weeks, you've had antibiotics, just come and get it checked.
Okay, that's a good message. So thank you, Dr. Marfu'ah, for being in our show today.
Thank you. We can pass over the podcast to me.
Then I'm out of job.
The Bald Oncologist Podcast Series